My name is Ken Leek. I'm 37 years old, and I would like to share my experiences of having a pre-existing medical condition and how it has affected my life due to my inability to obtain health coverage. When I was 20 years old, I was officially diagnosed with an extreme case of narcolepsy. Although I didn't know it at the time, this would be my pre-existing condition that would eliminate me from obtaining health coverage. The last time I had health coverage for more than 1 year was when I was 26 years old. Luckily, my condition of having narcolepsy was relatively inexpensive. My doctor charges me the absolute minimum to see him, and I get my medications through Costco, so in the end, narcolepsy only really cost me a little over $100 a month. That's all it takes to be denied any type of health coverage at all. $100 a month. That's too much for any insurance company to even fathom paying. $100 a month. That's how much it takes to justifiably deny me health coverage in any way whatsoever from any insurance company in the entire United States. Once you have a pre-existing condition, no insurance company will consider you. At age 29, I began to have a terrible pain in my right shoulder. I needed orthoscopic surgery. The cost for the surgery and minimal physical therapy that would follow was a little over $7,000. The surgery was presumed successful, and the physical therapy was to last 6 weeks. On the 4th week of physical therapy, the pain in my shoulder began to increase. By the 6th week, the pain became dramatically worse. At that point, there was no more they could do for me because I ran out of money. After that, I couldn't work, and it was difficult to function for about a year. I had to accept the fact that this wasn't going to go away, and my only hope of ever having a normal life again was to find something that would at least give me enough strength and flexibility to do some sort of work. So, because of my narcolepsy, I couldn't operate any type of motorized vehicle, and now, due to this injury, working on a computer, my expertise, being in print and web graphics, was out of the question. I was now limited to jobs that didn't require any fine detail work. At 30 years old, I met a Pilates instructor who helped me for a very low cost. Only through her training was I able to develop the strength to handle low-impact labor jobs that didn't require fine detail work. I was still in severe amounts of pain, but I was pretty much used to living in pain. As long as I wasn't doing fine detail work, I could just barely handle it. Through my own determination, I have acquired enough strength to compensate for the pain by leading a very healthy lifestyle. I also focus on trying to keep a positive attitude, as I've come to realize that only the present matters. However, in order for positive change to happen in the future, positive action must be taken now. To think I could have continued to go to physical therapy after my surgery back in 2000 if I had health coverage. A public option would have been an ideal solution. I've heard two main arguments against the government providing a public option. One is that a public option would be too costly. I've been to the emergency room 3 times in the past 5 years, racking up thousands of dollars in costs each visit. The state of California, our tax dollars, takes the majority of the fall, but I still would have to pay $300 to $700 each time. Walk into any ER and you will see large amounts of people in there without life-threatening situations. The second argument I've heard is that people don't want the government involved in their health care. This is an illogical argument because a public option will have no effect upon any private insurance companies other than it being a business competitor. Remember, Medicare and Veterans benefits were portrayed at one point as having a government takeover agenda by conservative media when these were introduced. It's the same game of those who profit from the financial backing of health insurance lobbyists looking out for themselves and their lobbyists. They get rich by denying coverage, raising premiums, keeping people underinsured, and dropping people from their plans if the person becomes too expensive. That's a real death panel. Don't be fooled by the insurance companies and their money. Listen to the people who have been there, who have truly experienced serious health problems within our current healthcare system. One day, it could easily be you.